Welcome, everyone. Welcome to our live. And today I have Dr. Roberts with me, and we're going to be talking about natural medicines for mental health. And just for a little bit of context, Dr. Roberts was the man who downloaded half of the knowledge into my brain about natural medicines. So it was only apropos that I asked him to come and be live with me and talk about this stuff because A, he's way smarter than me in this category. B, he is the face that you just made insinuated that you think you're not. B, he's going to be way more, I want to say frequently updated with his research. Is that fair to say?
I don't know how often you update, but it's possible.
I believe in you.
Okay.
I believe in your nerdiness of going on PubMed and being like,
Fingers
to
crossed.
do. And also I respect you. So I figured I would bring you on here so that we can have a valuable conversation and educate people in an effective way instead of everyone going onto Google and typing in, what should I take for my mental health? And then, thinking that if you drink a chamomile tea that we're going to see actual benefits to your anxiety overall. Okay. So why don't we take a moment for you to introduce yourself in the way that you want, even though I really started you up here. But tell everyone what you do and how you work with mental health.
Right. So my private practice is mental health focused. So and actually anxiety focused. So that's most of what I'm doing. And obviously with anxiety comes other conditions. But yeah, and I teach at the college, which is where Jenna and I met, Canadian College of Naturopathic Medicine. I supervise there at the teaching clinic and teach primarily diagnosis, but also there's the lectures in integrated therapeutics. Of course, they're about therapeutics. So that's on a variety of topics.
Yeah, that's
I
kind
guess
of
that's
why.
about it. Yeah, go ahead.
That's why I picked you. I mean, obviously, I know that you have the general knowledge of everything science and diagnosis based, but I do know that obviously your practice focuses in mental health, which is why I picked you. You are the chosen one.
I am the chosen one.
So why don't you tell us, and then because everyone who's going to see this replay or anyone who's in here live right now is either one of my patients currently, or they are in my community where they know how I practice mental health. So we'll get to me, but let's talk about you, how the natural medicines play a role in your practice versus the other work that you do. And I don't mean other work in like outside of your private practice. I mean, like, if you're working with someone on their anxiety or their depression, mental health, stress, whatever, how much is natural medicines related and how much of it is lifestyle medicine or counseling related?
Oh, that's a great question. Yeah, because I would say the majority of it is solving problems in people's lives and pointing out sources of their anxiety and just talking through things that are going on with them. So I would say that like when you say natural medicines, like supplements, herbs, things like that, it's a relatively small part overall, I would say. It's not as though like nobody takes that stuff. That's not it at all. I would just say that the majority of any visit is spent doing other things besides discussing, supplement doses and stuff like that.
Yeah, I would say probably like 5 to 10% of my practice is actually prescribing.
Yeah, I think that's
just based on a function of what people bring in. And also like each appointment that I have with someone, there's a consensual moment where I go, is what you're coming for even supplement plant medicine related?
Yeah.
Like, are you even interested in trying these things and seeing how they can optimize what it is that we're working on? Because not everyone comes in and goes, yeah, I want plant medicines, natural medicine, supplements, whatever. They just want to connect with you and then have you say at the end, okay, like this is what we're working on. And then here's also this, if that's going to be helpful.
Yeah.
So I would say it's a very small portion of what I do, which is not conventional because people come to us because they think that we are the masters of natural medicines and that all we do is prescribe. We get put in the wash with people who are functional medicine doctors.
Yeah.
And I think that I've spent a lot of time, both in my community and in my patient visits, where I'm saying, okay, these are going to help a small portion, but they're not going to actually complete the picture of what it is that we're working on. And there's
Yeah.
so much other shit that we're going to have to attend to aside from taking magnesium.
Yeah.
Right.
Yeah.
So we
I'm glad
will.
that I didn't know that it sounds like we have similar approaches. I didn't know that. That's
Don't
cool.
pretend that's not why I asked you here today.
I didn't know. I mean, so this is why maybe you knew better than I did.
Don't I always? I'm just kidding. That was a
That's
sad. No, I just started this saying that you're smarter than me, so we need to approach this
right.
as
We
I'm the
have to.
dum-dum. Yeah. So now that we're aligned on that front,
Right.
now that we got that out of the way,
Right.
I want to know from your perspective, like if we have a patient walking into the office right now or coming into your virtual space,
Yeah.
or someone emails you, or someone, in my case, it would be DMs me on social media and goes, what should I take for my anxiety, my depression, my mental health? Like, what are the best researched plant medicines, natural medicines, supplements that are going to require more of our attention? Does that make sense? So like,
Yeah.
if someone asks me, like, what are your top 10 things? Like, I have a list of things that I'm going to try with a patient
Mhm.
before I ever start dabbling into the explorative side of things.
Mhm.
And I think that that's where the evidence-based approach for me rings true, because I have the same way when you guys go to your family doctors or your psychiatrist or whatever, there's going to be like a little protocol list of, if person has this symptoms, you give them this. And if this doesn't work, we give them this. It's like, I have a first line, second line, third line type of situation, so that there is a little bit more of a medical approach versus a feeling approach, right? I don't want to say to someone like, oh, I feel like you need this plant medicine, or I feel like that could be a good supplement for you. I'm like, no, we're going to go with the research because it says this. We're going to pair it with this. We're going to try that first for 4 weeks. We're going to then pivot to this if we don't see an improvement there. So I like to keep it very, the natural medicine side of things is very medical. And then the rest of it is where I get to be creative with how I incorporate the care that I do with a patient.
That's really cool.
For you,
Mhm.
if I could say to you, okay, like what are the top 3 plant medicines that you prescribe for anxiety? I think we could split it for anxiety and depression if you want to lump it together both. What
Yeah,
would they
well,
be for you?
I would say, well, if we're starting with anxiety, I would say probably what it's looking like right now is that Selexan is the sort of is the king. Now there's caveats. The Selexan is a lavender extract.
Yeah, make sure you don't talk in brand names, only because everyone's from different places. So not everyone's from Canada. We have people in the States that are going to be listening to this, like a good
Well, no,
portion.
well, actually, you can't even get it in Canada. Well, you can order it from the States. So this is the issue, right? It's the product to just ignore what you just said. There's a product called Calm-Aid, by Nature's Way that that has Selexin in it. As far as I know, there's still no way to get Selexin in Canada. It's not that it's sort of too dangerous. It's just that I mean, again, I'm not exactly sure on the
FDA
commercial
side of things.
details.
Yeah.
No. I don't think like there's no. It's not a safety thing. It's just an availability thing. So
Can we pause and explain to everyone, because I know what you're talking about, but can we explain to them why you're using this term and this word? So
yeah,
it would be, you tell
ahead.
them.
No, you go for it.
No, you tell them.
So Selexin is just the name of an extract, an essential oil extract from lavender. That it's was made by a pharmaceutical company in Germany, and they're the ones that did all the research on it. And so that would be the main caveat. Well, so there's a few caveats, but one of them is that they did all the research on it. So for some people, that's kind of a non-starter. They say, well, then I don't trust the research at all. I think that's probably an overly cautious attitude. I think maybe it's just like a best case scenario, maybe, if you want to think of it that way. But I don't get the sense that they did like 20 trials and like 17 of them were negative and they only published 3. I think that the good thing about Selexin is that they've compared it to the standard of care, which is SSRIs, the pharmaceutical standard of care, SSRIs. They compared it to placebo. They've compared it to benzodiazepines in the context of sleep. And yeah, there's lots of details where we could get into about we could nitpick, but I think overall it's got the highest quality evidence, showing benefit. And it's easy to dose. Yeah, go
You've been
ahead.
a king of lavender
Mm,
extract for probably 5 years. I think that the research has been so compelling to you.
mm,
And you've looked at all of it that you're like, okay, this is consistently performing the best for both anxiety and depression and sleep, and knocks that off of our plate. At least
well,
that's
I
what
don't.
I remember that about you in
Yeah,
clinic.
I would say I would make stronger claims about anxiety than depression. But yeah, it's definitely something it's kind of a, who
Consistent.
knows? Who knows how research will go in the future, but right now that's how it's looking.
Yeah.
Yeah.
And again, for those of you who haven't really picked up on what we're talking about with the Selexin, is it's like, think of it being a patent brand of lavender that they said, okay, this is our lavender and we're putting it inside this supplement. And now we're going to research this specific thing. The same way that, for those of you who know what L-theanine is, they have like a patent on sun-theanine, which is what's put into different types of supplements, so that those companies can say, we have the sun-theanine or we have the Selexin, that the research is showing. So I think that this research is going to be clinically relevant for any type of lavender extract supplement, even though that would be the industry standard or the gold standard. But like lavender sap through NFH, if you're in Canada or whatever, like they're not using the patent brand for that, are they?
No. And that's, they've dosed it the same, and it's sort of a kind of a Me Too thing, and nothing against NFH. I mean, right, but that's not the same thing.
So you're saying that if you're going to treat someone with lavender, you're going to try and get them to find that specific blend.
Correct.
Okay.
Well, the specific extract, Selexan. Yeah.
Yeah. But now what are you doing with the Canadian patients? So like anyone who's listening who's
you
from
can
the
order it.
States, so they can just cross border and get it.
Well, they can just order it from Amazon.com. I did see it on.
I have shtick with Amazon.com.
Well,
I've talked about that live before too.
they have it. I saw it on Walmart.ca actually the other day. So, and occasionally it's out of stock. It's a popular product, but yeah, that's, other than having a shtick with Amazon.com, that probably is the most reliable way to get it.
Okay. I mean, that would be your best. It would be your best advice for someone who was wanting to look into lavender as a treatment option. Not that we don't have 5 billion other treatment options, which we will get to, but I know that you like lavender. So I'm glad we got that right off the hop, and with the particularity of saying, okay, this is the proprietary blend of lavender extract that I like using. And for all of you who are listening right now, I said this before as my haha disclaimer before we started and went live, but lavender extract by mouth inside a capsule is very, very different therapeutically than the lavender oil that you're getting from an essential oil company like doTERRA or Sage, or ordering off of Amazon.com and saying, I'm taking lavender for my anxiety, but it's in your diffuser, or you're putting it on your temples. There is a very giant difference, and I can't stress that enough, between the transportation of a natural medicine into your body. We can't just ignore the science and technology that goes into getting these things inside our body, right? The same way, and it sounds so stupid coming out of my mouth right now, but you can't think of lavender and be like, I feel relaxed now. You have to actually take it as a medicine. And that's why in these clinical trials, they're testing it against SSRIs. I'm assuming they picked fluoxetine for those studies because it's going to be a basic one that they have.
Well, it was paroxetine that they used as a comparator.
So, in our studies, we're now talking about taking it by mouth, an actual extract of lavender versus an SSRI. We're not doing any clinical trials and studies on diffusing lavender into the air, or having a lavender pillow, or having a lavender eye mask. And obviously, yes, there's going to be studies out there that show that. And I know that massage therapy with lavender is better than regular massage. It's like, okay, great. But we're talking about real clinical results of people that aren't a little anxious sometimes. We're talking about moderate to severe anxiety on a GAD-7.
Yeah. Well, and just to say, I mean, I know you set this up as, somebody asking you for advice over social media or something like that. I mean, it really, the devil's always in the details, and I probably wouldn't personally make recommendations over
Of
social
course
media.
not.
I would,
Psh,
yeah.
You think I would touch that with a 10-foot pole? Do you know
Well, so
me?
just because that's how you set me up here, Jenna. So I just want to make
I
sure
love
that.
a good setup. And you know what? I might troll
Mhm.
you later on socials.
Okay,
But yeah. So let's pivot from lavender for a second because we zeroed in super fast.
sure.
So what other natural medicines do you find that you use in practice very
Mhm.
frequently aside from lavender?
I think probably next up for me would be ashwagandha. I
Mm-hmm.
think that's a much loved supplement. And it's got some research for anxiety. It's got some research for actually a lot of things.
Yep.
And but one of the things that one of the indications that's been more of a focus has been sleep as well. And so it may be, and Withania. Sorry, the Latin is Withania somnifera. So the somnifera, excuse me, the somnifera is a good reminder that it may have some sleep helping properties. But the yeah, so I think probably if you were looking now, not that lavender doesn't have some study for sleep as well, but it may be that ashwagandha um, pushes us a little more in that direction.
Mm-hmm. And for those of you listening, because you guys all know I'm a big ashwagandha buff, it's one of my favorite supplements to take for myself. But we have to make sure that when it comes to ashwagandha, that we are finding a supplement that actually has the proper percentage of withanolides, because that's also the bioactive ingredient in the supplement. A lot of you, if you've said, oh, well, I tried ashwagandha once, and we're talking about a powder that you stir into your water from the health food store, we're going to be talking about a massive and dramatic difference in therapeutic effect with a supplement that has a certain dose that is taken at a specific time with a certain amount of active ingredients within the supplement versus I drank an ashwagandha tea or I had an ashwagandha powder and I didn't see any changes to my anxiety or my sleep or my depression or my stress or my cortisol. It's like we have to do it within the context of what the research is showing. And I think that that's where the natural medicine industry has led people astray. And it's been taken over by social media. It's like, here's a mood boosting supplement. And then someone's like clickbait. They're like, yeah, it's going to fix my mood. And they click on it. It'll be like, and it has ashwagandha and it's this many milligrams. And the first thing I think is that the amount of milligram powder that's been crushed of the plant that's been put into a capsule? We know
Yeah.
nothing about the quality of what's going in there. And then I feel like people lose faith in supplementation or natural medicines when they go, oh, well, I took it for a month and like nothing changed, or I took it for a month and I only got like diarrhea, or they like say, it's like, we can't ignore quality control. And we also can't ignore that the people who are often creating these supplements that we're seeing put all over the place, they are not only do they not understand the science and the technology, but they're banking on the fact that you don't fucking know it either. And they're like, we're going to make some money and we're going to make it super expensive. So you think it's great. And then there's going to be like some weird sort of subscription that you have to, buy into so that you get 3 at the same time. And then you're saving money and it's good and it's going to make your life better. It's like, remember what I said at the beginning of this conversation, the plant medicines or natural medicines are like 5 to 10. I would say even less than that at times. In comparison to the bigger picture. Is the ashwagandha changing you, or did the concept of you starting on a treatment plan make you more focused on your mental health, which has allowed you to reach new places inside your own psyche that has made you feel better in its totality? And I sound like a naturopathic Dr. Hater right now. And I know it.
Wait, why do you say that? I don't understand. Why do you?
Because
Yeah, go ahead.
just because people are so heavy on the prescribing. People are so
Oh,
heavy
yeah.
on the what do I take? And it's like, oh, well, if you took these things, you'd feel better, you'd get better. That's what you need to take for your anxiety, and that's going to make your sleep better. And I love that you use the word caveat because I haven't heard you say it in so long. But every caveat I give to a patient is we're going to take this, and I have no fucking idea if it's going to work, right?
Yeah.
Like we're going to try. The research shows that it's helpful. We're going to see how you respond to it, and you feel better, great. And we'll never know if I have magic hands, if you have the best pill in the world, if you are the king or queen of placebo effect, like I don't
Yeah.
know and I don't care, because the only thing that my job is to help you get to that next phase of feeling different.
Mhm.
And I never like saying to people feeling better, because what the fuck does better mean? We just
Mm,
feel different. We feel a little
mm,
different than we did before. And like if we maintain that curiosity and go, okay, without the word better, that doesn't mean the next time you fall into a blip, it's worse or it's
mm,
bad. And mindset and language is a huge thing that I work with people on.
mhm,
Because we say I'm doing it naturally because I don't want the magic pill, but then you're
mm.
also searching for a magic pill and natural things, being like, might be it. It's like, or we blow that theory completely out of the water and you are the only person in charge. And whatever you take is your choice. And however you feel is your experience, right?
Wow,
Um,
I mean, actually kind of just want to know more about your approach. I did not that, I mean, you're the host here, but that's really fascinating.
we can grab a coffee one time.
All right, fine.
I mean, we could get to it. It depends on how much time we have.
Sounds good.
So here's another question, which I
Mhm,
think is fair.
mhm,
And I kind of alluded to it right now. But when you give and prescribe in your practice,
mhm,
what do you say to your patients? Like, hey, this is what I expect.
mhm,
Or, we're doing all this counseling and talking, and I do a lot of nervous system regulation. I have no idea what you do in your part of that practice.
mhm.
But it's like, okay, what can you say to your patient? This is what we're looking for after this period of time.
Yeah, so I try to be uh, as specific as possible. It's hard, right? So you can look at so research gives you basically a nice sort of reference class that you can extrapolate from. So if the average improvement in anxiety score was 30% reduction, you might think of that as, I mean, that's an average, and people go on either side of that. Um, you may have reason to believe that they will benefit more than the average or less than the average, but generally speaking, you're trying to, at least for me, I'm trying to give them an estimate about how much it will change the things that they are, um, uh, the concerns that they have. And one of the first things we do in a visit is talk about people's specific goals, right? Which are rarely, like, people's goal is not like bring down my GAD-7 score. Sometimes it is, like, it's as simple as like I just want to be less anxious, right? That's a common thing.
Every patient of mine is probably listening, being like, I would like to lower my GAD-7 score.
Okay. Okay. There you go. But people have concrete issues. They have reasons that they booked the visit, right? And
Yep.
so it's going to be like having difficulty doing presentations at work, or being scared to get on the subway, or whatever it is. And it's helpful to say or to sort of ask the question, how will we know when you're feeling better?
Yeah.
Sorry, but
Ugh.
like, how will we know? Like, if
Yep.
if I if I saw you a month from now and you were feeling better, what would you be doing? How would you be acting differently, and so on? And those can be goals, right? And so we can try to relate it to those goals somewhat, um, so that it makes sense why somebody would be taking what they're taking. But this is part of the reason supplements are a small part, is because often to get to those goals, it's not through a route of supplementation, right?
Precisely.
Or the supplement. Well, look, the word supplement is so handy because it is supplementary, right? It's not. It's not probably good, or it ought not to be um, the core of the plan. And I just want to. There was
I
something you
loved
said.
that. No,
Yeah,
I loved it.
good. Yeah. I think people do use supplements, and this isn't sort of damning every naturopathic doctor, or doctor for that matter, but people
Yep.
use pills as a shield, or as an alternative to um, meeting people as another
I
human
just got a
being.
shiver down my spine when you said
Yeah.
that. Ugh.
Okay. Here comes another one. Um, no, I because I think that people, it's really it can be very hard, right? And it's actually, in some ways, like, I um, joke with my students, like, our visits, even at the teaching college, the visits are an hour long. I've said, like, if I found someone on the street, like just walking down the street and said, okay, we've got somebody in here, they're feeling lousy. You have an hour to make them feel better. Can you do it? You know what?
Yes,
That's
we
actually
can.
that's not actually that hard, right?
It's not. It's not.
You know, if you have an hour to make somebody feel better, you can probably manage. Like, most people can probably do something to make somebody feel better. So a lot of times we get wrapped up in, okay, I have to give this pill, I have to give that pill. We do have appropriate, like, professional limitations on what
No,
we,
I don't.
and again, well, you don't, but the rest of us do. And I think that but we get caught up in, I have to prescribe this or whatever.
Yeah. Or
And
the disappointment of like, ugh, this person came to see me and I'm going to ruin their hopes and dreams by telling them it's way beyond what you put in your mouth shit. Right.
well, and that is something that I face as well, is and this is, again, maybe another tangent, but people who are experiencing, profound anxiety often believe that it must be their hormones. It must be, this other thing, because there's no way they could be feeling this much anxiety just because, they changed jobs, or
Yep.
just because they're lonely, or whatever it is. But in fact, anxiety, it is profound in its effect, and it can be a mundane cause for a profound feeling, right?
Yeah. And that's why I'm so big on talking about the nervous system as root cause, because I think people, I hear so many people say to me, there's no reason for me to be feeling this way. I don't understand what my triggers are. I can't make sense of this. And I'm like, because you keep trying to speak English and knowledge to a system that doesn't even speak that language. It would be as dumb as me heading over to Hong Kong and trying to talk to everyone in English, being like, are you picking up what I'm putting down? I'd look like the stupid blonde in the middle of the crowd being like, no, run along, right? And it's funny because we're like, well, it's our bodies. We should just listen. We should understand. And people have trouble amalgamating the brain and the nervous system and how they are not speaking the same language right now, and how no matter what you put in your mouth, you can put 500 pills in your mouth until you get sick to your stomach. You are going to be bypassing the actual root cause. We can de-intensify heart palpitations and unsettledness, and helping people with sleep, and making people's response to cortisol maybe be a little bit more robust. But we can't take away the way that they process information and how they process their emotional state. And we're filled with a society of people who undermine their experience with like an odd narrative of it's like, I feel like I'm surrounded constantly by people who are dissociated with their actual physical experience. And then looking around and being like, well, why if that person's having a relationship issue and like I'm having it, but they're fine. Like, why is this happening to me? Or if we lose someone in our life, maybe someone passes away and we're like, well, they were fine. Why is this happening to me? And we're always in this comparison land of like, if we just took a second and fucking looked inward and went, shit, I'm in pain, instead of trying to flail and fix issues and just sat with ourselves instead, we would be having a very different human experience. And that's why when I work with people, before we ever put anything inside of our mouths, I'm like, sure, I'll help you with a little bit of that stuff and that small 5%. But if you don't do the body work and you don't do the cognitive work that's associated with priming your body to receive whatever you put inside of it, you will get nowhere and you will fail every time. And most of the people I work with are high achievers who like they're like, just let me keep going. And I'm like, we have to do so many more things. Let's shift your intensity into yourself and the energy you put into yourself before we start throwing, I call it tentacles at the wall, being like, okay, well, that therapist is going to fix me and that medicine's going to fix me. And if I'm in a better relationship, that's going to fix me. And if I just do this, I'm going to be better. And I'm like, I always say this, and I think I say this on every live, wherever you go, there you are. So you can keep fucking turning every corner.
Wait,
and
somebody else said that. Somebody else said that first, Jenna.
Wherever, wherever you
Right.
turn, you're just like, shit, shit. And it's like, you can't escape that. And that's why I say like the first skill that I work with people on is mindfulness and meditation. If you can't sit with your shit, there is no amount of ashwagandha I can give you to make your life better if you don't like living inside your own skin, right? So I teach people the skill of regulating their nervous systems and understanding their own trauma responses and how how our nervous system engages with the world, but also how to be uncomfortable and comfortable at the same time, because everyone's like coming to you in your office being like, fix me now. You could sit with them for an hour and just stare at them.
Well, you touched on a couple of things there, and I'm probably going to forget all the things that I was thinking along the way because there was so much really interesting stuff. But one of the things that occurred to me is, um with mindfulness, one of the pitfalls for people who maybe have a tendency towards anxiety.
I'm so excited for you to bring this up.
Really?
Yes.
Do you know what I'm going to say already?
Yes.
Oh, okay. Is that there's at least two components to mindfulness, right? To mindfulness meditation. There's the part where you pay attention, and there's the part where you have to be non-judgmental.
Exactly.
And if you are someone who has a tendency to anxiety, probably that non-judgmental part is the part that's missing. You're actually totally fine paying attention to your body. In fact, the whole issue is that you're hugely on the judgment of these body sensations, and you're extra vigilant, right? Vigilance is potentially a big component with anxiety, and so it's training the non-judgment that's the really big deal there.
I'm sorry, I have a shit-eating grin on my face.
I didn't know you knew that this is kind of one of my shticks, so I'm glad that
so we've never had a shtick in a bit about non-judgment?
I honestly don't remember what sometimes you just talk to people and you figure they're not listening, but I guess that's
I'm
not
always
you.
listening.
I assume none of my students are listening.
Oh, that's funny. So that, like, when I work with people, and I have a motto, it's called sit with your shit. And it's a muscle that's required to be flexed. So just because you go into a meditation one time and it leaves you feeling completely agitated and sketched out that you're now aware of everything, if I send you to the gym and tell you to do 10 pull-ups, you're going to come out of that being like, shit, I couldn't do one. And now I'm so sore and I don't want to go back and I don't want to do that. And we practice the mindset work of sitting with your shit as we're sitting with our shit. And I actually teach meditation in that way, with the preparation and understanding and knowing that that's already what you're going to buff up against first, because I practice it. Right.
Yeah.
And I think it's all in the presentation of how it's delivered to someone. It's about the informed consent that someone gets before they go into it, which is why I hate when people come to me and they'll be like, I've been doing meditation and it's not working. I'm like, so you're listening to a guided meditation on YouTube to get yourself to go to sleep?
Yeah.
Is that what you're telling me? And they'll be like, yeah, it's not working. I'm like, because you're not learning any of the lessons or the actual, you're not building the muscles that are required to be flexed in order to learn how to sit with your shit. You don't know how to practice non-judgment. So like when I first start working with patients, that's the first thing we do. It's almost like a mindset deconstruction of like welcome to my appointment. Everything that you think you know, we are going to wipe you clean, like Men in Black. They're and like you forget everything. It's like, I want you to take all of your mindsets and recognize you have you bring the comedy to the table and you say, I don't know shit. And I'm willing to question everything that I've ever believed before this moment so that I can actually get to the other side. So I approach all of this with, I'm not going to make you better, but I'm going to make you fucking curious. I'm gonna make you downright curious to look at yourself differently, because if you start looking at yourself differently, the entire world changes. And I think in the fight or flight, we are very rigid and we don't have the creativity to go, okay, this is what I'm going to do and this is how I'm going to see it. So when we start doing the nervous system techniques, it brings us to a place where we can be like, okay, I've brought down the fight or flight. I can hold myself and feel okay for at least 15 minutes. And in those 15 minutes, I'm going to now be creative or unlock that part of my brain that gives me the opportunity to see myself differently. I just think that that's where also the plant medicines, and that's where actual conventional medications come through, right? Because they always say I can't tell you to go to therapy if you're still here being like, bah! Like we have to bring you down and then say, okay, now let's be in that space together. And I think that with any patient who's ever worked with me, there's been a moment where they've come to me and been like, bonkers. And then by the end of the appointment, they're like laughing with me.
Yeah.
And it's a way of like looking at yourself differently. And I think that that's what comes when you're in a non-judgmental therapeutic environment with someone who's like, you crazy, I'm crazy, we're crazy. Let's talk about crazy, right? And people always say to me, oh my God, why do you market yourself as a doctor who has anxiety and depression? I'm like, because I'm a fucking doctor who has anxiety and depression, and I can
Yes.
actually sit with you in it, right?
Honest,
As
yeah.
opposed to the other person who has never had depression a day in their life. And they're like, why can't you brush your teeth? I'm like, I'll tell you.
Well, and one thing that comes to my mind when you say all this is, I mean, and I'm sure you're not downplaying this, but I'm sure it can also be a real challenge for people. So often a component of anxiety for people is almost a meta anxiety, like an anxiety because they've had a really bad experience with anxiety or depression in the past. And when it starts to come up again, the dread related to that previous experience feeds the new one. And so and you might call this catastrophizing, you might call it trauma, you might call it
I call it anxiety inception.
yeah, oh, that's
Yeah.
cool. But it's once you kind of learn how deep your suffering can be, people will often be sort of forever afraid of it, or afraid of it thereafter.
Like a panic disorder after a panic attack.
Certainly, like a panic disorder developing after a panic attack, or like just a fear of one's depression or a fear of one's anxiety. So yeah, sitting with it is a pretty big request to make of someone in that situation, to say, you've got these physical sensations, you've got these feelings. I mean, that is sort of their phobia, right? It's a very overpowering sensation for a lot of people.
It's overpowering until you have someone in it with you who's going, I know this is scary. And I think that that's the difference, or at least the way that I get to work with my patients is I'm not saying to them, and I like analogies. So do 10 chin-ups. You're going to spend 3 hours at the gym today building your arm muscles. And by the end of the week, I want to see 10 chin-ups. It's like, let's try a chin-up. And then we do a chin-up and we're like, that was shit. Okay, that was shit. Okay, what skills do we need to build in order to get there? And it's almost like it's like breaking things down to present it differently. And I've had loads of patients be afraid of how I approach things. And I've also watched the exact same people who were flailing in the wind at the beginning, being like, oh, I don't know. It's like, I can't feel my heart rate. Like I used to get air hunger when I would do anything. And I thought about breathing. How did I work through it? I sat with my shit, right? Is it going to throw me into a panic attack by being uncomfortable? No, because now I'm in a safe space. So meditation becomes this, it's like a playground. It's like controlled exposure therapy. It's like, okay, if I'm afraid of those things, now I'm going to sit with the discomfort of what I'm experiencing in a safe way, knowing that if I need to exit or leave, I retrain my nervous system that this is not a fear, right? And we come at it from a different approach. And I don't want to spend too much time on meditation because I could get stuck talking about this for 500 hours and everyone knows how I feel about meditation. So we're going to have to zip my mouth right now. And I do want to bring up a question that I think is going to be important for a lot of people, because a lot of patients I work with and a lot of people that are in my community are on medications for their anxiety, their depression, whatever they're working through. And I think a big fear for them is coming off of medication and also working within the framework of, okay, I'm on a medication and I want to help myself with a natural medicine at the same time or supplements, because we know that they can work very well integratively. But people are so afraid. People are so afraid of their conventional medications. I think it's a fascination and it's mass hysteria. Like people will take a medication like a lorazepam or an SSRI, whatever they're taking, and they'll go out on Saturday night and drink.
Yeah.
Or they'll go out to a club and take MDMA. but they
Okay.
won't take ashwagandha on top of an SSRI. And I don't know why. I find it
That's
so
funny.
funny as well, because like there's this mass hysteria around holy shit, my medication interacting with natural medicines.
Mhm.
Because I think that the way that it's portrayed is like, don't mix your medication or you might get this and you should
Mhm.
be afraid of that, because everyone's always trying to fear monger the natural medicines because we're like freaky deakies. So can we talk about some hard lines between which ones you would never give someone or prescribe on top of an SSRI or a benzodiazepine?
I think probably so just on top of an SSRI, I think most people would say that you wouldn't recommend something like St. John's wort. That may be too obvious to be worth stating.
I don't
I
know.
don't.
Nothing's obvious. It's obvious to me, but it's not obvious to the people listening,
Yeah.
right? I've
Well,
had people take both.
yeah,
I have
and the
had
thing is, yeah. Sorry, go ahead.
St. John's wort is a good example, because
Mhm.
I've had people say like, hey, I'm on this med and like I was thinking of taking this blend, and I open it up and it's like St. John's wort. I'm like, no, fuck no. Just from a
Yeah.
safety perspective. But no, you continue.
Well, I mean, arguably, like I don't know how. I mean, theoretically, that is a bad idea for. And just to spell that out, serotonin syndrome is not something that you want, excuse me, to have, and that's the theoretical risk. Taking something like St. John's wort along with um, an SSRI. Other people will caution the use of something like rhodiola with an SSRI. The reason being that rhodiola is thought to have compounds in it that are monoamine oxidase inhibitors, which can sort of potentiate the effects of an SSRI. But you'll also see, like, I was looking at a research paper a few months back where they gave rhodiola with an SSRI and found that it had um, was it an SSRI or St. John's wort? It might have been I can't remember which of the two. But anyway, it was, that theoretical interaction would have been there, and yet it was uh, quite beneficial for the people in the study. And
Mhm.
so, not everybody feels the same way about these things. There are just different types of interactions. There are interactions that are kind of what you had in mind. I mean, it could be that if you are taking a medication and you also take a herb, and they both have the same effect, they're both, let's say, sedatives, then that might actually be what you're going for, because one of those alone was not sufficient for you and you wanted an added sedative effect. And it's not that they act necessarily synergistically, it's just this theoretical thing. Look, these are both sedative. Maybe you don't want to take these together, but also maybe that was your goal. But there are other interactions where certain herbs, again, St. John's wort, St. John's wort has this effect of sort of revving up a liver enzyme that that sort of detoxifies certain drugs, or sorry, moves them through this pathway a little bit more. And um, that's a different type of interaction, and that would affect a number of drugs, right? And sort of the opposite of grapefruit juice, which also has
Yeah.
also has
I think a common
a
one would
reputation.
be like birth control and St. John's wort, right?
Right.
Um,
Go ahead.
I try and like, just at a safety perspective, like I try and only prescribe St. John's wort when my patient is on no medication.
Mm,
And I also try and particularly select my patients based on how much time they spend outside, how fair their skin is, like
mhm,
just from that perspective, because I don't want to give someone photosensitivity, because that wouldn't be nice. Like if they're already anxious and depressed, and now I'm like giving them a sunburn.
mhm,
So it's just to the point before that you were making about
mhm,
blending them in the research. It's like
mhm,
we're always so obsessed in this industry of like, does it perform as well? What happens? What are the interactions? But like
mhm,
there's no such obsession in the conventional medication world, where it's like, I know so many people listening to this right now are like, I've been on an SSRI and I'm on a benzodiazepine and I was also prescribed an antipsychotic on top of this. It's like, why
yeah.
does no one care about the interactions of like much stronger medications? And we're sitting here having a conversation about rhodiola. And like, I think that what it does lend to at the end of the day is most people who are trying to do it naturally or are more concerned about medication are going to have more sensitivity in their bodies. So they're going to feel those things and be able to say,
Mhm.
oh, I notice my energy is affected by this. I notice that my heart palpitations are changing because of this. It lends for that type of mind, right? We're more
Mm.
analytical people that are in the more of like a I'm scared of what I'm putting in my body
Mhm.
category.
Mhm.
But like, why are me and you, maybe just me, why are we treading so lightly on natural medicines and
Mhm.
not giving like a banger of a of a treatment protocol when
Mhm.
someone might be on way stronger medications that are de-intensifying their experience and they're also getting drunk on the weekend and they also did mushrooms a month ago. It's like,
Mhm.
why are we now suddenly worried about rhodiola or
Well,
like St. John's wort, you know?
Jenna, I think you and I may be in our own bubble, because I think that outside of our bubble of, careful and conscientious practitioners, there are some real, cowboys and cowgirls out there who, whether they don't know or don't care, or think they know better, are in fact, much
Call
less,
them cowboys.
or cow. That's
No,
just the
no,
term.
that's no, it's so true. It's
I
so
may sound
true. It's
maybe
like
sound like an old person, but
no,
that's
no,
just the
it's like the
term. Yeah, there you
wild west.
go. Yeah. That is a real thing, and so, I mean, I don't mean the Wild West. I mean, this sort of different approach than um, than how you were trained, than how I was trained, than how we practice. We're quite careful.
I don't even want to call it careful. I want to call
Mm,
it precise
mm,
or and I don't mean to toot our horns, but I mean it's more intelligible. And then it's also we get into a conversation of why are we over treating?
mhm,
Like why am I trying to change this person's experience of themselves long
mm,
term? Which is it's I don't know. I struggle with this. Do I want people to feel better in the short term and they want to feel better? It's like, yeah, but I also would love for you to get to a point where we don't need anything anymore and you've actually worked out your shit and now you're comfortable and we've increased your window of tolerance to life.
mhm,
Instead of being like, I don't want anyone to ever start a plant medicine because when people start medications, they're like, I don't want to be on this forever, or
mhm,
I came off of that at this time. It's like the
yeah.
lingo. And now people are like, I
Mhm,
don't want to be on rhodiola forever. I'm like, you're not. You
mhm,
could take it for a week and then stop. Like, or when I came off of the St. John's wort, I'm like, you didn't. You just stopped taking it.
mhm.
Like this isn't this. It's it. I can't.
My favorite is "My doctor put me on."
Yeah.
It's a really funny, even if you try to visualize that
Yeah.
conceptually, like your doctor sat you down on an SSRI, like it's a
They put me
funny
on this. Yeah.
term. Yeah,
Yeah,
you
no,
put
I
me on.
totally get that. They put me on it and it's like, were you needed for that conversation? Were you a part of that
Mhm.
appointment?
Yeah.
I'll sometimes ask people, did your doctor tell you what to expect? And they go, oh no, they just said I should feel better in like 4 to 6 weeks. I'm like,
Mhm.
well, that's a fucking lie. That's medical misinformation. You might
Mhm.
feel like absolute shit in a week from now.
Mhm.
You might feel like a basket case at 6 weeks from now. There's
Mhm.
actually no confirmation.
Mhm.
The best tool that a doctor can give, and I think that a lot of doctors medicate because they want to save their asses or they want to be like, okay, well, I gave this person that option. So now my foot's not in the race anymore. Like I told them what would be helpful for them. And if they don't want to
Mhm.
take it, that's up to them.
Yeah.
And instead it would be responsible to say, this is an option if you'd like to do this.
Yeah.
Here's the other option if you want to go another route.
Yeah.
But the best advice that a doctor can give is say, find out what resonates with you and select a few. If you really want the results, select a few.
Yeah, well, and I don't want to necessarily come off as an apologist for the conventional medical system, but I think some people do take it that way when I say that, like, if I only had 7 to 10 minutes with
Yeah, it's
a
terrifying.
patient, I don't know what I would do. I mean, I certainly couldn't do what I do now. So, I said earlier that people use supplements and things like that as a shield from patient and human to human interaction, but also sometimes it really is, if you only have time for that, like it's a system, right? It's a
Yep.
system thing rather, like there's a lot of I don't know. It's hard to know how medicine would be, how conventional medicine would be if the appointment times weren't so limited, you know?
It's not even for me to think about. That would be like a save the world situation, and I don't. I'm
Right.
saving the world in my own way.
Yeah.
And if people want to work with me, they can.
Hmm.
And I don't like it's not for me to say that doctor did a bad job. The more
Hmm.
that I look at it though, I think to myself, how um it sounds so bad, like intellectually robotic you must be, or like to think that you're doing a service to someone when in fact you might be giving them the worst decision of their life.
Mm.
Like it's just it's hard for me to say, and like what it makes me want to say is, okay, doctors have there's a role for them, but you need to expand your care for your own self. You have to know that you have to expand your circle beyond what that offers you, because
Mhm.
it is the bare minimum. At every possible best case scenario we look at this, it is the bare minimum.
Right.
And like I see people in my Facebook group, I'll be like, where do you get your mental health care from? They're like, family doctor. I'm like, "Meh,"
Hmm.
right? Like we need
Okay.
to expand past that.
Hmm.
Can I ask you a question?
Of
Personal?
course.
And
I
also,
hope
do you need to leave immediately at 2? Like, do you have somewhere to be, or can I like steal you for a little bit longer?
a little bit longer is fine. Yeah.
Okay. I hope everyone else is okay with that. They don't care. They're going to either listen or they'll listen after. It's fine. Absorb the knowledge. So
Mm.
what's your favorite plant medicine, natural medicine supplement to
Mhm.
take for
Mhm.
you when it comes to your mental health?
I don't regularly take anything, and that probably doesn't surprise you. I have taken, as a student, and I wouldn't advise this to any students listening now or in the future.
A
I don't think
nootropic?
I don't think self-experimentation. Well, nootropics have their own roles as a student, but I think I think self-experimentation is not just overrated, but you know, deceptive. I don't think it's a good idea. But anyway, I did try Kava Kava, and I did try ashwagandha. Um, Selexin was not a popular thing when I was a student. Actually, lavender, for whatever reason, wasn't.
Yeah, it's been
What?
more new.
Yeah.
Yeah.
So, but I don't. I wouldn't say I have a favorite, to be honest. I think it's going to be whatever works. Um, for whatever situation one is in. Why do you have a favorite? I'm curious now.
I don't discriminate.
You don't discriminate.
You want to
Did I
talk
say
about
discriminate? I should
you
have
want
said
to talk
differentiate. Discriminate
you
such a dirty word.
want to talk
Yeah.
about cowboy?
Okay. All
Pew
right.
pew. Yeah, no, I actually I like to know what it is
Uh,
that I'm looking for. If I'm
yes.
looking, I'm hearing a lot about people's personal experiences. So while I'm
Mhm.
also doing the nervous system work, and actually I practice what I preach.
Mm.
Um, from a standpoint of I don't want to feel like an imposter, and I don't want to
Mm.
have intellectually dishonest moments.
Mhm.
And I also don't think that I can lead or guide anyone if I don't know exactly what fucking roadblocks are around you.
Mhm.
Like you can't be a meditation teacher if you don't yourself have a meditation practice, because how
Mhm.
are you supposed to guide and help someone when they come up against a higher level concept than you even conceptualized yet?
Mhm.
Right.
Mhm.
So I do like to practice what I preach. And I know that we just zipped meditation back in there, but I also like to try all these different supplements and plant medicines in all the facets. Like I'll do anything just to
Mhm.
see what type of experience it can have on your emotional state. How it's helpful, how it's not helpful. Like I think it was last year I did a microdosing mushroom protocol, because it was getting so popular and everyone was coming being like, what do you think about mushrooms? And like, should I do that? And like I'm not afraid of talking about this online, but I've done psychedelics a lot. And I'd never done it in this microdosed fashion, which is what everyone's talking about, like all these schedules. So I was like, I'll fucking try it. I'm not afraid of anything. So I started doing it, and I was logging what was happening in my experience during that month of doing it. And the thing that I came out with at the end of the day is, if you are someone who's like this, maybe you have emotional regulation issues, and maybe you there's like higher sensitivity to physical sensations, or if you have low motivation, maybe this is not for you, because
Mhm.
these are the way it made me feel.
Mhm.
And we're not going to have that many clinical studies on this, but like, I want to know that before a patient comes to me and goes, should I microdose mushrooms? I want to give them proper informed consent of at least an anecdotal experience. If they're just following someone on Instagram being like,
Yeah.
that's the schedule and this is the company I'm getting it from, it's like, I want to know what the feeling is, so that when they bring the feeling to me, that they at least feel safe and know that they're not unheard or misunderstood, or that they look
Mhm.
crazy. It's like, I actually know what you've been through, and I'm going to validate that experience. Um, so I do like to try different plant medicines. I would say ashwagandha is definitely more of a go-to for mine, just as a
Mhm.
general. It's part of like my basic mental health support,
Mhm.
like vitamin D, magnesium, B complex fish oil. I would already put ashwagandha in a baseline, simply based on the fact that it doesn't interact with any other plant medicine, so it's good to
Mhm.
go. So that would be my favorite.
Mhm.
I've also had patients who absolutely hated it because it gave them other symptoms that they didn't like. So everyone has to have their own individual approach. That also brings me into another topic, which is like, and in your practice, I know what I do
Mhm.
in mine, but
Mhm.
what are your thoughts on blends versus simple and singular plants?
Blends of what? Like
So like,
products that include, oh, sorry, wait.
yeah, like synergistic. Like, do you like blending, like in a product that already has rhodiola, ashwagandha, L-theanine, and like phosphatidylserine or something?
Mhm. Well, no, there are definitely people who seem to benefit from products that are blends, and so I wouldn't necessarily write them off entirely. I think probably the majority of what I'm usually recommending things based on like what I'm hearing from the patient, and but I'll do like individual products that have individual things in them. We end up with maybe a blend, but it's just rare that I would find a blend that has kind of what
Yeah.
I'm looking for. There are products you can consider as a whole though, and they may have benefits. I just want to go back to what something that you said. I mean, I understand, and I know I'm in the minority here in saying that I don't think self-experimentation is a particularly good avenue. I understand that people will probably um, trust someone who says they've taken it themselves a little bit more. I don't know if that's a well-placed trust. I mean, I don't know if that should make a difference. But I think that probably when you take something yourself, um, you're giving yourself maybe a valuable, a far more nuanced experience than you might get if you just read a paper or read about a plant or something like that. But I actually don't think that it adds much to informed consent, and in fact, if anything, it might add um, a little bit of bias, towards your own experience. So, and that's why I discourage, because I said earlier, I discourage students generally from doing self-experimentation. I think, if you do self-experimentation and you base to any degree, almost to any degree, base your results of that self-experimentation, if you base patient recommendations on that, you are going to be in like uh, you're going to be making some mistakes. You're going
Yep.
to be making some bad recommendations. So
Yep. And
anyway.
that's why at the beginning, when I said I have a plan in place for my practice, is this
Mhm.
is the first line, this is
Mhm.
second line, this
Mhm.
is third
Mhm.
line, and then we
Mhm.
have, okay, now we're in exploratory territory.
Mhm. Mhm.
Because
Mhm.
what works for me doesn't work for everyone. I
Yeah,
can't take
that's right.
valerian. It keeps me up all night,
Yeah.
sweating and shaking, which is fucking weird because like everyone else gets a nice sleep, and
Well,
I'm sitting
no,
there.
that's actually not that uncommon.
There's
It's
10% of the population
yeah,
that gets a paradoxical reaction. But
yeah.
if you go on Google right now and say best plant medicines for sleep, you will
Yeah,
find valerian pop up and you will take it.
yeah.
And then if you are like me, you're going to be up all night going, what the fuck did I just take? What's wrong with me? And it must be me. I must be the problem. And now you're afraid of plant medicines ever again, right? So I definitely do not base my recommendations on my patients off of me, but I
Yeah,
also have anxiety and depression, so I treat myself all the
yes,
time.
yes,
And I have my plans in place to make sure that my treatment is objective and not
yes.
subjective, but I also like to bring in the exploratory component as well.
Yeah. Well, I didn't mean to chastise you on your own podcast, but
That's
I'm
fine. I
I'm
told you to bite
pedantic.
and I'll bite back.
Okay, fair enough.
So I do we talked about ashwagandha, we talked about rhodiola, we talked about St. John's wort. I threw out L-theanine into the air.
Mhm.
Um, we talked about lavender. What are your thoughts on like passion flower, 5-HTP, um, saffron?
Oh, saffron of all the things you just mentioned, I would put saffron probably highest. Yeah, saffron
Me
has
as well.
that handy So when there's a depressive component to the anxiety, or I
Yeah.
guess an anxious component to the depression, but I think that that's a really interesting set of indications for that saffron seems to shine with. So yeah, so that's one there. I mean, theanine, it may have some specific indications. I think probably in some respects it's overrated.
I agree.
Yeah, but you know, on the other hand, it's safe as it's among our safest
I know.
interventions. It tastes like fruit punch in many of its formulations, and you know, so people do take do seem to enjoy taking it. There's a huge you know, sense, it gives one a sense of control
Mm-hmm.
to take pills sometimes, and if you have something that you're taking just before you go into a stressful situation, as is often recommended for theanine, that can give you a sense of control, which is a big part of anxiety. Not that I mean, I'm not sort of saying that it's good for that reason. I'm trying to sort of rescue it from its
No, I
overratedness.
like that. I liked that because that's actually the only way that I'll prescribe GABA and L-theanine. And I'll do it in like the liposomal version where they can squirt it under their tongue for whenever they're feeling that they're activated for whatever reason. Because the research shows that it's only supposed to de-intensify the cortisol curve for like an hour or two. And if for something that you can take that frequently, because it's only in your bloodstream for that long, it's a great rescue remedy. And maybe over time, what it does is it actually trains the nervous system like, shit, you don't have to fire like that. You can actually maintain your homeostasis, and we don't have to have that nervous system response. It's the same way that you'd be training melatonin if you want to fall asleep at the same time every night before bed. It's like you take your 1 milligram low dose, you get your brain to release your melatonin, and then over time you stop taking it because you're now going to bed and getting tired at the same time. It's like, okay, what if we utilize the research for what it's worth? GABA performs absolute shit in the research from what I recall, but
I
what
wish
it's
more
really
people
Yeah.
acknowledge that.
and but it's all over the internet. GABA is so amazing for anxiety. It's like, no, what the research shows is that it blunts your cortisol curve when exposed to periodic stress in the moment. So why would you not utilize it for what it's worth? Instead of saying this is an anxiety medication that we take in the morning and at night, what I'll use it for is, okay, if you're feeling something coming on, can we blunt the cortisol curve so that the neural pathway that's firing goes, oh, no, we're not going to strengthen that. We're going to choose another one this time.
Yeah.
And in that case, like I've used it for people in the middle of the night too, waking up, panic, boom, back to bed.
Yeah. Well, I mean, the thing is, and that's a challenge, right? Because there are many things that will abort a panic attack if taken early. I mean, having some people have have an elastic on their wrist and they snap it, and that sort of is helpful for them. But I wish there was more clinical research with patient-oriented outcomes, which is to say things other than lab values for some of these things. I think probably what makes people or what prompts people to use things like GABA and or glycine, things like that, is mechanistic reasoning.
Functional medicine.
They did, yeah, and so they did, they went through undergrad, they went through the first couple of years of medical school or the first year of medical school, and they think that foundational to everything is biomedicine, and that therefore they should choose their treatments based on mechanistic pathways. But that's just not the world we live in. We don't live in a world where you can come up with a plausible mechanism and actually have that be correct. That's just it turns out that things are more complex than that.
It turns out.
And yeah. And so I'm kind of almost more suspicious when, well, I'm not more suspicious, but people persist in using GABA despite the lack of clinical evidence, when in fact we have so many other options. I'm just really, it's a bit disheartening that persists. But anyway,
I just don't think, and I have this interaction in my Facebook group a lot because someone will pop in there and be like, I take this, it's changed my life, it's done all this. It's like, okay, like, biased anecdotal evidence. Like, let's Bring it
but
down
also
here.
good for them, right? I
Yeah,
mean, yeah,
amazing. Amazing that you feel good, but let's not create a false promise in someone else. That's the same thing
yeah.
as being like, I pray and it changed my life, so you should pray. It's like that what works for one does not work for other. And I also think it's important because like everyone's throwing around the term science. In the
Mhm.
past like 2 years, there's been a lot of like, this
Right.
is what the science shows. It's like,
Yeah.
do you know how to read a research paper?
Yeah.
Did you actually even have access to opening that article to be able to read it? And did you know how to find the discerning information? Do you know what statistical significance means? Do you know how to extrapolate animal results to human results? Do you know how to look at a proper sample size? Like these are basic things that when it comes to our industry, it's like you should know how to do that,
Mhm.
but people still don't know how to do that. And now we're expecting that skill to be known by the general population.
Mhm.
Like if we typed in something right now, like research on whatever, we're going to find some
Mhm.
blog post that's going
Mhm.
to tell us this is what the research showed. It's like,
Yeah.
oh,
That's
okay.
what Google shows you, Jenna. It only
Yeah.
shows me research papers.
I'm so evolved. I only get PubMed. But like I find it interesting how like people stand on this moral pedestal of this is what the science is showing and that's what research showed. And then showing me a picture of like the Krebs cycle or something and being like,
Right.
see? And I'm like, okay. I mean, I'm not going to argue with you, but now when we bring it into the context of normal people who are
Yeah.
actually trying these things in a clinical setting, is your best answer that only 40% of people are going to see an impact? And if is that it, what if you're in the 60% that's not going to see an impact? Then what do we do? Do we just shame the thing, or do we say like, okay, it worked for some, it didn't work for me? There's just so much that goes into it. And I think
Well, and
people lose sight.
there is an ethical difference between somebody experimenting on themselves, which is more or less free of ethical implications, unless you're responsible for someone else and you're risking your health. But and also just people posting, I tried GABA and it worked for me, which they're not a doctor. It arguably they're misleading people, and so whatever. But then on the other hand, nobody says that you you know can't share. I mean, you can't share
Free speech.
false things by accident, right? Like if yeah, well, if there was sort of a law against people sharing things that aren't accurate, like it's not even necessarily a lie, it's just spreading misinformation that you
Right.
truly believe, right? Which is again not um,
Yeah.
not as ethically concerning. But there is an ethical duty for a clinician like you or me to not say things that aren't justified, and that there aren't good justifications for. And so, random person saying I tried GABA and it worked for me, that's great. But if somebody like you or me goes on social media and starts posting things like that, that's not okay,
Right.
right?
And that's how I navigate my Facebook group is people come in
Yeah,
all the time and say, I did this, 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 this. And I go, that's amazing. I'm so happy it worked for you. But as
yeah,
a responsible community leader, like we need to make sure that we're not providing any medical advice, whether it's
yes,
direct or indirect, because everyone's going to have a different experience. And like, I use one of my patients as an example about this all the time because it's
yeah,
funny, but like I put her on ashwagandha and she was fucking hurling all over the place
yeah,
like for weeks and was like, she was also taking other things at the same time. And she's like, it can't be that. And like, eventually when I was like, we're going to stop everything and pull it off and reintroduce, it was like, we find out stuff. And it's like, why would you, hold on, there's a car alarm going on outside. Can you hear it?
it cut out on your mic, so that was good. If it's
Can you
still
hear me
going,
now?
I can hear you. Yeah.
Oh, okay. So yeah, that's just, I like everyone to have a tempered approach and like everyone can't put all of their eggs in the natural medicine basket. And I've said that so many times this week, like we need to diversify our income when it comes to our mental health. We can't just be like, okay, plant medicines are where it's at, or like, meditation is where it's at, or going to psychotherapy is where it's at. It's like, okay, what if this revolutionary thing that we do is use all the tools and kind of see if we can create a difference within ourselves, and then not cheer on what we think is so amazing and working so well, and not bash on the things that we think aren't working, and just for a moment go, maybe everything is playing its role in this puzzle that I'm building, and like we're all kind of fitting together nicely, and things are different. And whatever's causing the change, whether it be placebo, whether or not be because you finally like started unpacking stuff about the way that you process information, or whether it's what you're taking by mouth, they all are equally important.
Yeah.
And I think that that's something that I want that message to come across to everyone who listens to this. Because I gotta say as bluntly as possible, I'm so sick of hearing people say, what do I take for this? What do I take for my anxiety? What do I take for my depression? I'm like, honestly, all bets are off. You could drink orange juice and I don't know if we're going to see a difference at this point. Like,
Well, so tell me, I mean, maybe you can, and I know I don't know what your hard stop is here, but I am curious if you're like in a high achieving anxious population, is expediency not one of the values here? Like, are people not just interested in, getting
correct,
something fast? And is that
correct.
so? And that's something you're fighting against, I would imagine.
Right.
Well, not fighting against. That's
Not
too
no,
maybe
I'm actually
too brutal and
fighting. I'm
yeah.
fighting
Okay.
with. No, I'll say to them, like, when I first meet my patients, I go, okay, we're gonna have some like blunt, honest truths.
Mhm,
These are the things I'm gonna say. You can either pick up
mhm,
what I'm putting down or not. But if you're gonna work with me, I want
mhm,
you to recognize that at every single moment you get, I'm going to take that mirror and put it back on you and go, do you like what you
mhm,
see? What do you
mhm,
think? How do you think this is contributing to that experience that you're having over there? And I
mhm,
think that what happens is when the high achievers take off their blinders and
mhm,
they have these conversations, they go, holy shit, like
mhm,
I am in charge of this and I am causing this stuff and my mindset is contributing to that because they
mhm,
already have the natural intellect, because
mhm.
they've already gotten to where they've gotten to in their lives
Yeah,
and they're already processing information at such a high speed. It's like
yeah.
I see the fastest growth within them. And
Mm,
then I think what I cultivate with my patients is that extreme level of truth and honesty, and like
mm,
it's like comedic self-deprivation.
mm,
They're like, okay, like you can see me, you see me through my skin. I don't have to pretend that I'm
mm,
this thing anymore. And they just like take off their armor and they're like,
mm,
okay, bring it on. And I think that that's the informed consent that I give to my patients is
mhm.
this isn't you coming to me and me tickling your back and being like, everything is going to be okay. I'm going to say, me fucked up, you fucked up. Let's talk about the fucked up. And
Mm,
and I think that it brings in that the desire for change. It's like, oh, you're a role model because you're actually stepping in your shit and walking your walk and talking your talk
mhm,
and doing all of it. Okay, good. That I can get behind, because
mhm,
high achievers have this thing about them where they have to respect where their messaging or the signal is coming from. They
mhm,
they have a high propensity to being like, no, what you're saying doesn't matter. That's not going to help me. That's not going to work. And then I
mhm.
look at them in the eyes and I go, it's going to work. Trust me. And usually they're like, okay, yeah, you're fucking right. And it's the way that I approach people like
Mhm.
that, because that's me. Like you're
It
not going to
sure
find
is. I've been sitting here thinking, wow, this is like this is exactly if you'd sort of asked me to write down a
what's
few
Jenna
years
like.
back, what's how is Jenna gonna practice? I might have guessed something like this.
Yeah.
That's
I
good. Well,
couldn't
it's
I
very
couldn't wait.
authentic.
I couldn't wait
Yeah.
to get out of there because I couldn't handle being stifled by the inauthenticity of how
Mm,
people were practicing. And like you can't create change within people if you're not willing to go to the bare bones, especially when it comes to mental health. Like, can you help people with weight loss? Yeah, if you could do that anyway, you could, if you help someone with their thyroid, you can do that very medically. Like you can do all those
mhm,
things. When it
mhm,
comes to actual mental health, and you know this from sitting in someone's space, like
mhm,
you're saying, meeting someone where they are, like you have to be connecting with them on such
mhm,
a different level to
mhm,
incite change.
mm,
You can't say something topical to change their life. It has to be, we're in the ring together.
mhm,
Like, I can handle your shit. Give it
mhm,
to me.
mhm,
Let's actually have the only conversation and safe place where you can do this. Like, let's do it. If
mhm,
you're already in the door,
mhm,
what are you hiding from at this point? Like, you
mhm.
think you're doing a good job at hiding? Like, I see you. Let's just take it off. And I
Yeah.
think that people appreciate that because everyone's operating in this world being like, don't see me, don't see me. I got to be perfect and I got to do this and I have to feel better because this and I got to show up for my family and oh, my baby. And it's like everyone's, and then you're like, okay, this, bring it back in here
Mhm,
and let's talk about it. And then
mhm,
let's do something about it. Cause
mm,
like I always tell people, you can talk about it all you want, but shit, if you don't leave this space and go do something about it, I can't help you. I'm not magical. All of
mhm,
this is yours. You have
mhm,
to show up for yourself. I
mhm,
refuse to work harder than my patients.
mhm.
And if my patients aren't working hard, I'll call them out.
Of
I'll
course.
be I'll be like, "Did you do it?" And they're like,
Yes.
"No." And I'm like, "All right. See you next
No.
week."
I
Um
yeah. No, that's it. I really love when people do that. it can be a hard thing to do for some people, but I think to you it probably comes naturally, I would guess.
Yep. I'm all about the path of least resistance, except when it comes to like doing the work, because then I'm like, oh shit, that's the word we're supposed to put our intensity. And I
Yeah.
recognize that in myself. So that's why I do that with my patients. Can I open up the floor for anyone who has questions? Because if you do, I would love to answer them. I'll see if there's anything left on my list of wanting to try things and bring into conversation. You did. I'll wait if anyone has a question. Let me open up the Q&A box actually. Okay, we have someone asking, I'm super interested in ashwagandha. I'd like to add it to my Zoloft. Do you suggest a certain strength brand on? Okay. As mentioned, this is not going to be personal medical advice for anyone. And I gave you all that excerpt in the Facebook group prior and through my email. So I'm going to answer this as if I was talking about myself and all the information we talked about today. Okay. Ashwagandha is not going to have any concerning contraindications with medication. So it's something that I feel comfortable prescribing when people are on SSRIs and people are on benzodiazepines. I'm assuming that you already feel the same way because we talked about that today, correct?
Me, I would just, I'm not
That's
making
fine. I'll talk.
recommendations. Yeah.
Yeah. So I would say, like, if you want to add ashwagandha in, that is a personal choice based on the science that we shared today. I would feel comfortable doing that if I was on an SSRI. And when it comes to the dosing and brands, that depends on the country that you're in. Dr. Roberts, for you, like when I take my ashwagandha, I take Ganda 600. And I think that has like a 500 milligrams with is it 1.5 or 3% with analytes?
I'm remembering it as 3%, but I could be totally wrong. But that's a very popular product.
So I would say if you're looking for an ashwagandha product, make sure that it says that it has withanolides in it if you want the most optimal benefit, and around a 400 to 500 milligram dose is what's I would say ideal. Most supplements are going to be that way, aren't they? They're usually in the 400 to 500 range.
400 to 500 of what? Sorry.
Milligrams per capsule, most often.
Yeah, or maybe a little less, but I'm just looking it up now. Oh no,
I feel like most of them these days, people are trying. Yep.
I'm looking up Ganda. That's okay. Keep going.
You're looking up Ganda 600. That's a Canadian brand for those of you listening. That's going to be AOR, right, which is white and purple. For those of you who are color oriented, it's white and purple. Do we have any other specific questions? Because if not, I do want to cover quick how you said, remember, you're like, some patients work well with blends, some people work well with singular stuff. In my practice, what I tend toward most often is doing singular plant medicines at a time. The supplements, I don't mind, like the magnesium, vitamin D, fish oil, B complex. I'm fine with, let's get it going on that part if you want to take it. But I tend to not prescribe multiple things at once so that I can see how the person's body's responding based on the concept that I do not like to overtreat. Like if you give someone rhodiola and they feel better after a month and they're noticing the changes, or if you give someone 5-HTP, or if you give someone saffron, whatever it is, it's like, why did we have to go to the trouble of saying, let's try rhodiola and ashwagandha together and let's also do, saffron on top of it? Because if they're seeing a benefit, we may as well try and give them the lowest dose of benefit for them to see it.
I'm with you. Well, that's my inclination, at least, as well. I think, though, that some people are what you get, and maybe for you, the way that you would deal with this is just tell the person what's right and what you sort of push back. I find that for some people, like there's sort of two extremes of the approach, right? One of them is to do one thing at a time. And one of them is to do every possible thing all at once, throw everything at the wall and just see what sticks, right? And if they feel better with everything, then you start subtracting.
I've done that too. It depends on the overwhelm.
It depends on the overwhelm. It depends on, like, there are people. So this concept of treatment burden is, I think, underappreciated, especially among naturopaths who can and do give so many treatments sometimes. And they don't realize that diet is an extremely burdensome, dietary changes can be extremely burdensome, lifestyle change can be extremely burdensome. When you can give, 5 pills or whatever for somebody, 5 different things, because you're not afraid of interactions or whatever, rightly or wrongly, that means the pill burden is extreme as well. And that's a financial burden, and so on and so forth. So, and for a lot of people, maybe most people, those things are burdensome. But there is at least a subset of the population who, the more things they do, the better, the happier they will be. They will believe they're getting better treatment. The more money they spend, it seems, the better treatment they believe they're getting. The more pills they're taking, the more they think they're doing for their health, and so on. And so, for people of that mindset, it may be that that trying more things right from the get-go is the way to go. I mean, I think that there's different practice styles there. The only thing I would object to is practitioners who insist, in my opinion, again, just my opinion, who insist on doing just one or the other and not sort of listening to
Correct.
the patient.
Yeah. Yeah. I would say even from that approach, like for me,
Mhm.
that it's still a 5%. I say we can take 5, we can take 1, but
Yeah.
you got to do the work.
Yes.
The work can't be done in that hour that you're with me once a month, because let me
Yeah.
tell you, you're not going to get better if that's the
That's
case.
right.
Like you got to be doing that work day by day, or at least multiple days a week, where you're working on your nervous system so that your symptoms are changing in intensity and that you're actually feeling change, so that when you come back to me, I'm a launching pad. I'm
Yeah.
not sitting there absorbing all of the nothing's working. It's like, okay, did you do anything? Because if you didn't, like, again, the gym's a perfect example. You don't
Mhm.
run once a month and then go, oh, I need to get ready for that marathon in 6 months. And then you've only
Mhm.
had 6 hours on a treadmill thinking that that's going to prepare you.
Mhm.
And that's just the analogy that I like using, because it makes so much sense when it's physical versus mental.
Yes.
And then you get stuck in your own mental traps and your own cognitive distortions. It's like, you can't do this alone. Like, how many people have you seen work on their severe anxiety and depression alone and being like, I figured it all out. This is all great now. I'm never going back there again.
Well, it could be that there are lots of people like that, but they aren't the people who come to see us. We do see the biased set of people who are the
Yeah.
people who are having trouble managing it on their own.
Yeah. I would say I definitely, like, yes, of course, that makes mathematical sense. But I
Yeah.
also come up against a lot of people who are like, I've done it, or I don't know what I'm doing. And I recognize that, like, I shouldn't be in charge of this. And like, I trust you, so you're in charge of this now.
Mhm.
Or I know that there's something I need to work on and I don't even know what it is, but I'm willing to open up the door to see.
Mhm.
So it's just, I get a different type of patient that comes to see me very
I'm
often.
sure.
Because I find a lot of the time that the people who are so stressed out about their anxiety,
Mhm.
or their depression or whatever it is that they're going through, that they get stuck in the hopeless mindset and they flail.
Mhm.
And I see the flailing and I go, no, like, that's just not, I will be the first one to say when I can't help someone. I will
Mhm.
say, I can't help you because this is where your mindset is right now. Go
Mhm.
do that. And then I'll be here when you're ready, because
Mhm.
I'm not going to, again, work harder than you. I'm
Mhm.
not going to help you more than you help yourself.
Mhm.
And I feel like it's that tough love that's missing a lot in this industry, which is
Mm.
everyone's like, I'll help you. I can help you. I can help you. Try
Mhm.
this, try this. And it's
Mhm.
like, I don't even want you to try anything. I want you to do it and then come back to me. It's
Mhm.
not try it. It's like, get your head in the game and put the work in, and then let's have an honest conversation and see what
Yeah.
has come up in that time. So
Yeah.
that's how I operate. And
Mhm.
maybe you're seeing it as authentic. I see myself as
Mhm.
like a hard ass.
You're
Other
authentically a hard ass.
I just know that it's what works. It's the way that I would like someone to treat me if
Yes.
I let them into my sphere.
Yeah.
So it's like, why would I not extend that opportunity? Because the world is saturated with people who are going to treat you in every other way. How
Yeah.
many people are you going to find to work with that are having this approach? And
Mhm.
there has to be people out there for people like me, because shit, it didn't exist when I needed it.
Mm.
And I found the person who was going to work with me to like put the mirror up and go, no, no. And I was like banging my head against the mirror, being like, ah. And eventually I had to come to a moment where I was like, oh shit. And then I was like, hello, Jenna, nice to meet you. And we all have to go through that in some form of our own way,
Mhm.
to get to the other side.
Hmm.
My dog is now barking at me ferociously, being like, let me out. It's been an hour and a half.
Okay.
Please
The
wait,
dog
sir.
alarm.
Do we have any other questions? I feel like this is a lot to digest today. Yeah. So I will go slice this beginning off of the video so that we keep you kosher. And this live replay will be reposted at some point this weekend. For anyone who is here live, I want you to send me a message right now on Facebook through the Facebook group that says, I was there live. Okay. That's what I want you to do so that I can pass on the necessary information to you. If you have any questions about specific supplements, I will do my best to answer them in the most kosher way possible so that you have the education without my prescription. Okay. I hope that this was very educational for all of you. I want to say thank you for joining me. And that was a very great, unbiased, bitey conversation. And I appreciate you being here with me today.
Thank you so much, Jen. It was really fun.
I'm sure I will be able to have you on again to shoot the shit with me. You can pick the topic next time. I don't care.
Oh,
I'm open to talking
meditation.
about
I've already
anything.
picked it.
Well, did you listen to the other lives I did on meditation?
I haven't listened to them, no.
Okay, go listen to them
Oh, well,
first.
actually, sorry. I listened to part of one of them, but I haven't listened to all of it. Okay, so that's my
Yeah, it's your
my
homework.
thing.
You have homework. If you want to be able to talk to me about meditation, you got to go listen to the live on meditation. and then I'll be willing.
Okay.
I'll know that
All
you're
right.
worthy of doing your work, and then we'll just. All right.
Or I'll pick a different topic. Thank you, Jenna. Thank you so much.
Thanks for joining me. All right, bye guys.
Okay.
Have a lovely weekend. Peace.